right, good morning. For those who are joining us, thanks so much for joining us for our first virtual job spotlight in the healthcare field. So these are being sponsored by a number of groups, including CESA 7 and 8, the Ahnapee Youth Apprenticeship Consortium, UWGB, NWTC, and Inspire Northeast Wisconsin. So I'm just watching my folks here because as more are popping on, I need to admit them. We have three guests today who are going to be talking about their healthcare careers. I'm really excited because I know very little about healthcare, so I'm going to learn a lot. They are Jessica Atkinson, who is the Community-Based Residential Facility Administrator at Woodside Senior Communities. Melissa Engebos, who is a Neuroscience Navigator at the Aurora Stroke Unit, and Sandra Hanman, who will be talking to us about radiology and MRI. And advance the slide. So just a little reminder that next week we are going to have a longer deep dive with the Chief Nursing Officer, Ken Nelson at HSHS. So he's going to be speaking for 45 minutes on his background on healthcare, and then we will have our traditional virtual job spotlights with the three folks that we have right now are Dr. Adam Acher, who is an ER doc, April Flynn, who is a dental hygienist, and Jason Helgeson, who is the Purveya VP of Clinical Operations. So if you registered for this, you already have the registration, but if you know other folks who want to register, the registration link is on that slide. Just some norms to keep in mind. The meeting is being recorded and will be broadcast afterwards through Inspire Northeast Wisconsin. Everyone is muted except for our speakers, so that keeps down distractions. Everybody's video capabilities are turned off, so we just see your names, except for the presenters, of course. The presenters will be sharing their screens. Actually, I'll be sharing their slides, so that also will keep your distractions down. You probably won't be able to get back in if you leave the meeting, so keep that in mind. If you do have questions, and we hope you do, I read through all of the reasons that you joined today, so I grabbed a couple of good questions out of your registrations, but if you've got more questions, we'd love to hear from you in the chat. And Allison from NWTC is going to be manning that. So each speaker will have time to answer questions once they get done with their segment. And if we don't anticipate needing to do this, but we do have the ability to remove anyone from the meeting if they are distracting. All right, so just a reminder that we are looking at the patient care field in the month of November. So when we look at the career pathway map for patient care, there are really four subcategories that we look at: direct care, and I believe we'll be hearing about some of that today, nursing, and some of the ways that you can go in that nursing field, behavioral health, and diagnostic services. So watch for those as we hear from our speakers today. And advance the slide. So I'm going to start a poll. And the question for the poll is, of the three careers being discussed today, which do you know the least about? So the three things you're going to be hearing about today are healthcare administration, neuroscience nurse navigator, and radiologist MRI. So if you would please click on the career that you know the least about in healthcare. And once I hit launch, there we go. And then we should be able to see your answers pop up as you click in. And there we go. So nurse navigator, neuroscience nurse navigator seems to be taking the lead over the other two. And I will admit that is something I do not know anything about either. So I'm excited to hear about all three, but that is a new one for me. All right, I'm going to end my poll, and then Allison's going to let me know whether it's still on the screen or not. So it should be off. Is it off?
It isn't on mine, but
Okay.
I'm going to,
Not off
but it's
on yours?
probably, yep, now it is.
Okay, now it is. Okay, because we had that problem last week. All righty. So we are going to start with the first guest today, and I'm going to turn off my sharing for just a minute so that you can see Jessica, but she's going to be sharing with us a little bit about health administration and her pathway to get there, which I know also includes some physical therapy, I believe. So I know we have students interested in finding out about that as well. So let me stop share so we can see Allison. No, not Allison. Jessica. There we go.
All right. Hi. Is it all working good?
It is. Mhm.
Good. All right. Yep, I'm Jessica Atkinson. I am an administrator at Woodside Senior Communities. I am a CBRF administrator, which is a community-based residential facility, or one of the licenses of assisted living that you can have in the state of Wisconsin. I don't know if you want to go to my first slide or not right away, but
right now.
a little bit about Woodside. We are an 18-acre campus in Ashwaubenon. That is our front entrance to our main nursing home there. If you want, you can click to the next slide. That is actually our entire campus. So most people don't realize how large Woodside Senior Communities is. So we are an 18-acre campus. We are a nonprofit organization that is run by an executive team, which consists of myself, the administrator of our nursing home, our finance director, and our HR director. And then we have a board of directors that is made up of our fellowship churches that also support our campus. So we have the full continuum of care for seniors. We have independent living, assisted living, and nursing home. And we actually have one of the largest short-term rehabs in our area. So we work really closely with a lot of the hospitals on short-term hospital outpatient stays. So after someone's recovering from a surgery, hospital stays are typically getting shorter and shorter. And so then those patients are transferring over into our rehab, where we then get them better and get them back home. And then we have the largest CBRF in the area. So if you want to go to the next slide, thank you. So my career path started out, I went to Ashwaubenon High School. There I was a student athletic trainer. Ironically enough, Jason Helgeson that you mentioned that's going to be speaking in October was the lead athletic trainer at that time. So it kind of shows you how small the healthcare world is, even all the way when you're back in high school, how it makes a difference. I did the student athletic training program, which then also helped me be able to take general classes at NWTC my senior year. At that time, I had thought I wanted to be a licensed athletic trainer, and so I was planning to go to UW-Oshkosh. When I went to NWTC to take my some gen classes that I was taking, I found out about the PTA, the Physical Therapy Assistant Program, and it really appealed to me for a couple of reasons. One, it was a 2-year program, which I found appealing because I was excited to get out into the workforce. 2, it actually paid more than the licensed athletic trainer. And I really liked the rehab part of doing the athletic training and learning kind of how the body worked together and the whole kinesiology of it all. So it definitely appealed to me with that. So I switched and decided to do the PTA program. When I graduated as a PTA, my first job was in an outpatient peds clinic. So I kind of thought I wanted to be in the opposite end of the spectrum, working with kids. As much as I loved that, our clinic kind of started branching out, and we did more outpatient into some of the home, like with home health agencies, and we did some occupational health. And my boss at the time kind of kept pushing me out into the different things that we were branching off into. And that really got me a lot of exposure into different aspects of the PTA field. And then that's how I actually ended up at Woodside in their nursing home. So I went over and was working in their short-term rehab as a physical therapist assistant. I was doing that for about 6 months, and they asked me if I would be willing to start filling in on Fridays for our program director because she was working 4-day work weeks. And so at the time, I just said yes, didn't really know what it entailed, and started doing that, and I really liked it. And then when her position became available, they asked if I would be willing to step in and be the program director. So at that time, I ran the therapy for all of the short-term rehab. So all the physical, occupational, and speech therapists, as well as the PTAs and the COTAs that worked in that department. And about 4 years ago, our CBRF administrator retired from here. And at that time, the executive director that was in place on the campus had asked if I would be interested in moving into a higher administration role here to kind of help with some of the strategic planning and, creating more wellness and things like that across our campus. So at that time is when I switched over into a CBRF administrator role. You want to go to the next slide? Those are just some fun, cute pictures of seniors. Who doesn't ever want to see those, right? You can go on to the next slide. So what is a day in the life of as a healthcare administrator? Honestly, I don't really think there's such a thing as a day in the life of if you're in healthcare administration. It's constantly changing, which I really like. It's very fast paced. COVID has definitely shown us how much everything changes. You have to be really able to just kind of take on new challenges as they're coming. We're responsible for producing all like the policies, protocols, the different procedures that our staff use. So when COVID came, obviously that was a huge thing. We got to work with a lot of different departments like public health, the state, UW-Madison, establishing, good PPE policies and infection control policies and procedures. We're responsible for the communication with all of the staff and the families, making sure all of the regulations are being followed, that we're complying with all the governing authorities that oversee us. So we have, CMS, the Certified Medicare Services, Department of Health Services, Public Health, all of those entities. I drive the quality improvement process program that we have for the assisted and independent living. And that's really exciting because we get to find things that we think we could do a little bit better at, and then establish small work groups and kind of figure out how we can constantly be improving what we're working on. And then we do a lot of community outreach. So the other administrator and I do a lot of different lunch and learns. We do job fairs, get to do a lot of volunteering. That's the part that's probably one of the most exciting things that I like to do in our role, is getting to network and get out and figure out how we can make those connections in our community. NWTC, actually, we partnered with them about 2 years ago now, where we started having CNA classes on our campus. So doing things like that can really help benefit the community and get people in our doors at Woodside. I love being able to find those connections and figure out how we can get everybody benefiting from those connections. And then working with our executive team, we do all the campus initiatives. So working on the partnerships with the different hospital systems. We're part of like the Bellin ACO, it's called. So we work with each of the different hospital programs and working on those, working on changing of our buildings. So we're constantly adding on. We actually opened a new memory care yesterday on our campus. So as we, do market studies for what is needed in our area, we get to kind of analyze that and work with different consulting firms to figure out, do we want to build? Do we want to add on? What kind of need is in the community that we can try to fit into and help with? So that's always really exciting. And then working a lot on the staffing structures for each of the departments. So, we have nursing, there's life enrichment or activities, we have dining services, maintenance teams, IT. So getting to work with all those different staffing structures is always kind of exciting too, getting all of those out. And then we're in charge of driving all the construction and as it happens on the campus. So as we are building this memory care and we just remodeled a bunch of our buildings, we got to be actively involved in, making sure that it was designed for who we're, targeting, our residents, making sure that everything from the flooring to the layouts of the rooms, that it fits the easy stands coming in and that the staff have accessibility to things. So it's really neat to be able to partner with those firms and kind of get the different healthcare entities and the construction teams in the room and figure out how we can build things to really meet the needs of our residents. So next slide. Recommendations that I would have for people that are looking into going into, honestly, anything in a healthcare field. Things that really helped me, one was the student athletic trainer program. I know a lot of the high schools still do have that, but I think any involvement in something, even if it's just a little bit into what you're looking into, can really help you kind of fine tune what you want to get into. Taking medical terminology classes, I think, is huge. Once you kind of have that basis of medical terminology, I feel like that really helps then the other classes that you take come a lot easier. So, your science classes, your, anatomy and physiology, kinesiology, biochem, all of those, I think as much of that as you can get in high school to help you kind of prepare for them when you get into college, make a huge difference. Shadowing, I can't tell you how many people I shadowed from every different healthcare entity, from X-ray, ultrasound tech. I knew I wanted to do something in healthcare, but I didn't know what, and that really helped me narrow it down. And then getting a job now as, a dietary aide in a healthcare entity or working as a personal care assistant. We have a lot of high school kids that actually work on our campus, and I think that exposure is really good. And then I always say working in the service industry in general, some of the most important skills that I think I had to learn for my role that I'm in now, I learned as, a bartender and a waitress, or working in dietary departments, learning that customer service aspect of it and just having all that exposure to different people really helps. And then, the biggest thing I always say is never say no to an opportunity. When I first was a physical therapy assistant here at Woodside, and they asked me to start covering on Fridays for the program director, a lot of people on our team thought I was kind of nuts at the time. I thought I was too, because they were like, we have this great opportunity. We're not going to pay you anymore for it, but you get to do another job on top of yours on Fridays. And it sounded kind of nuts at the time, but it gave me an opportunity to see an entire other side of the business that I was working in that I didn't even know it existed. So having that opportunity opened so many more doors for me going forward. So even if you don't think it has anything to do with what you're planning on doing, I just always say never say no to an opportunity, because I think that that's huge. So
I'm going to stop share so they can see you again, but we would love for you to ask questions in the chat, and Allison will let us know if any come through there. You talked about quality improvement processes. Can you just give one example of like a change that you were able to make through that quality improvement process?
So one thing, we do a lot of tracking and trending of everything from falls to the times our residents go to bed, staffing patterns, things like that. So one thing that we did is we started like going through all of our resident falls and then breaking them down by what time of day they're happening versus the shifts they're happening, things like that. And when we went through that, we were able to kind of identify that actually a lot of our falls we felt came back to our training programs. So we're finding that as a lot of our falls were occurring at the times that we had people that worked for our company for less than 6 months were on the floor. So we were able to identify that, and then we came up with a quality improvement program with our caregivers for those more veteran staff to help better educate our new staff off of more of the intimate details about our residents. So everything they needed to know for basic care is on there, how they transferred, what their needs were. But it was the little things like, Joan likes to have her nightlight on when you leave her room, and Susan will tell you she wants to go to bed at 7 o'clock, but you're going to get her in her pajamas. Don't actually put her into bed. She wants to be in her recliner, because if you put her to bed, she's going to try to get back up right after. So all those little things like that started coming out, and our falls cut in half. So working through some of those programs and getting that group together of, our nursing team and then our caregiving team to really break it down and then see the benefit for our residents is really fun.
Awesome.
Great.
I see
Do
we
have a
question.
question. Is Woodside allowing students to come in and shadow?
We are. So obviously right now with COVID, things are a little more difficult than they were before. But we do have some screening in place, and it would depend on there's certain areas of the campus that they wouldn't be able to shadow, but we do have lots of areas that are open that we're able to do that.
I have a question.
Yeah.
Yes, Taylor.
Oh,
So what's the kind of schooling or classes you had to take in college to become this?
So my PTA license actually, so to be a CBRF administrator, there's a couple different ways you can get that license. You can go to school specifically for that, or in my case, I had an associate's degree in a healthcare related field, and then I had more than 2 years experience. So I was able to just sit for my exam and go right into it. So there's different ways that you can get into the field. So either any associate's degree of a healthcare field and experience, or you can go and get a 2-year degree in the healthcare administration.
great. And just a reminder, if you have a question, please type it into the chat. Any other questions, Allison?
How do you go about getting a job shadow opportunity at Woodside?
You can go onto our Facebook page or onto our website, and there's different ways that you can contact us on there, and then that'll get routed to our HR director, and she can help coordinate that based on the department or area that you're looking at shadowing in.
Great. Thank
All
you.
right. Wonderful. So let me go back to sharing my screen and introducing our next speaker. So next we have Melissa Engebos, who is going to be talking to us about neuroscience nurse navigator position. She is with the Aurora Stroke Unit. So let me turn off my screen for a second so that we can hear from her.
Hi, I'm Melissa. So I know the Neuroscience Navigator title is one that a lot of people aren't familiar with, mainly because it's very unique. It's even unique within our system. So it's actually a combination of roles. It was a shortened way of saying stroke navigator, spine coordinator is actually what it was. The difference between navigator and coordinator is the navigator position is more all around. They still do patient care. We're still doing bedside work and community, whereas when you get into more of the coordinator role, you're looking at policies and protocols. So I do a little bit of each in each category, and it made it easier to combine them into one role. So that's where the title actually comes from. It's confusing only because it really is unique and we created it.
All right, let me share the screen so we can see your slides. There you go.
All right, so my career path. So graduating from high school, I had a great plan. I went to UW Whitewater for a year because I thought I wanted to teach Spanish. Not where I ended up. And like most college students, I took a job to afford college. And I actually found a job that I really loved. I was helping people at night with their nighttime routines, getting into bed. These are people who had high functioning memories, brains worked great, but their bodies didn't always do what they wanted them to do. So people who were quadriplegic, MS, multiple sclerosis, things like that. And I found that I had a passion for that compared to teaching Spanish. And one of my first people that I cared for on my own, 18 years old, had no healthcare experience at that point, and he could tell I wasn't comfortable. And what he told me 20 years ago, I actually to this day still remember and use. And he told me, I can tell you're uncomfortable. You should never do something you're uncomfortable with, but know that you're the only one that I have right now. And I realized that at that point I could make a difference, and I could make a big difference with small tasks. So I went home for the summer, kind of debating what I wanted to do. And at that point, my grandma had a huge decline due to Alzheimer's. And the family wasn't ready for her to go to a skilled facility yet. So that since I had worked with people in their homes, they had a brilliant idea that I should spend the summer with her. And at that point, I now had experience with somebody whose mind wasn't working at full capacity. So I kind of saw multiple angles and realized that healthcare was where I wanted to go. So I took a CNA course at LTC, Technical College, and started working in various facilities that had mentally challenged adults. And that was somewhere that I really enjoyed working. I worked through a couple of facilities. But everywhere that I worked, the nurses did the paperwork and the CNAs did the hands-on care. And that's what I really loved. I loved working with the patients. So I really had a hard time at that point deciding to go further. And then in 2006, I actually started working at Aurora in the hospital as a CNA, and it was a different world. I noticed nurses are doing the same bedside care. They're working with the patients. It's not just about the paperwork anymore. And so I decided at that point to go back to school. So I went to NWTC. I got my associate's degree in nursing, and I was given the option of working on the cardiac floor or the neuro floor at that time. And at that point, I just wanted a job. I really didn't have a preference. So I took the neuro floor because it was day shift. And I started working with stroke patients and patients after surgery, brain and spine, seizure patients, patients after trauma to the brain or the spine. And I really started to enjoy what we were doing because I felt like we could make a difference with some of these patients and really restore their quality of life. You can go to the next slide. So in 2011, the hospital offered a program where they would pay full tuition for nurses to get their bachelor's degree. So I looked into several classes and courses, and I looked locally, and I really wasn't finding what I wanted. I needed to work within my full-time job because I couldn't afford to go part-time. I had 2 kids at the time. And so I found Grand Canyon University. So it was a completely virtual course and it was done within 18 months. So when I looked at that, I felt like that's where I could continue my path on my career. Really didn't change where I was working. I still worked on the neuro floor. I still worked with the same patients. But throughout those years, I actually found that I really loved stroke. And the reason I found that was, again, going back, I always wanted to teach. And I found stroke, up to 80% of strokes are preventable if we get people the right education. So when I'm educating my patients, I'm not just educating them, I'm educating the families as well. And you start to see these people go, oh, well, I can change that too. And so you're affecting not just one person, but a chain of people. So in 2015, the American Association of Neuroscience Nurses released this stroke certification for nurses. It's 180 questions based specifically on various phases of care within stroke. So I like education, I'll go get a certification. So I went back and I got the certification so I can put some titles behind my name, letters behind my name. And that didn't change anything in my job, but it made it easier in 2016 when Aurora was looking to towards the path of Comprehensive Stroke Center, that they wanted somebody who had that specialized knowledge. So I had kind of prepared myself for that, taking the certification early. And so then in 2016, I took the position initially as a stroke navigator. And then the following year, they decided they wanted to be a Spine Center of Excellence. So they asked if I would roll that into my title, knowing that I loved patient education and patient care. And of course, you take on all kinds of things. So in 2016, I then became a neuroscience nurse navigator. And then in 2019, they decided that I should oversee the neuroscience program in addition to just working within it. It was easy to keep the title because it really encompassed what I did already. It added in a couple more policies, protocols, and procedures. But in order to oversee a program, you do have to have your master's. So because I had great success at Grand Canyon, I called them September 5th of 2019, just to get some information. And by September 18th, I started the program. So I am looking at a 2-year program for my master's at Grand Canyon with a graduation of May, hopefully. So that was kind of my path. It was very slow, but each piece was important. So what do I do besides overseeing the stroke and spine program? I touch a lot of different areas within the hospital. So most importantly, I'm still assessing patients. I'm still seeing my patients daily. From the time they arrive in the emergency room to some of them I call up to 90 days after they leave. If they still have needs, if they still have questions, they have my information and I'm able to be contacted. It's really important that I'm engaged all the way from the beginning, helping with treatment options, helping staff understand all of that. So it's really important with patients. For me, it's always been about the patients. The not so fun part of my job is the monitoring that we do. There's a lot of government standards that we have to meet within the stroke and spine programs. For the stroke program, there's 45 metrics that I have to watch on each patient. Thankfully, spine only has 18, so not as many there. But on each patient that comes in, I do have to go through charts, documentations, meeting with them to make sure that we're meeting those standards. And then annually, we have surveys from the governing bodies. So it's a lot of work to prepare. You have staff to prepare, documentation to prepare, and then they're within your building for 2 days for each survey. So a little bit of work there. And then it was interesting when I was putting this together, I didn't realize how much my initial choice of education carried through my career path, because really what I do now is I educate. And that's, again, that's what I want to do. That's where I enjoy it. So I'm educating patients and families at the bedside, from the time they come in to the time they leave. Even after they leave, we 2 years ago created a new stroke booklet that I have patients pull out, and I'll have them refer to specific pages to help them. And actually this year we just created a new spine booklet. It actually just came out last week. So something for me to talk to spine patients with as well. And then everything in medicine is evidence-based. So anytime any new evidence comes out, we're educating doctors. All of my nurses who work within my neuro program have to go through an 8-hour neuro day with myself and my partner to make sure that they're ready for those small nuances that do happen within the stroke population. And then the community. We have a huge community footprint. Annually, we do outreach with the gamblers. We've done 5th grade education. This year, we actually just started doing virtual 5th grade education. So we have a little bit of a learning curve with some of that, but we get to still meet and we get the information out. And the biggest one is really that community within our stroke survivors. They have their own unique perspective. They're very engaged. We have a stroke committee that we meet monthly with our survivors, and we really engage them. So in the pictures I have here, it's a group of stroke survivors at our community day, and then the gamblers, actually one of our stroke survivors got to drop the puck at our stroke event. So it really is about engaging and getting the information out there. And then through all of it, the theme really is collaboration. We are a site here that we have 4 hospitals that send primary patients to us. So I collaborate with their stroke coordinators at each of those facilities, making sure that they're also meeting metrics and standards. And then making sure any new evidence that comes out, we go through. So then next one I think is, so recommendations. I hated having to go through all my math, and I was like, why do I need to know math later on? Let me tell you, in healthcare, the most critical medications you give are weight-based. And of course, they're not in pounds, they're in kilograms. So first you have to take your weight and you have to get the kilograms off of it. And then you need to be able to figure out what the right dose is, because those are critical and actually can cause adverse effects if you're wrong. So it's really important that math is a big focus, as well as science. Understanding how the body works and the pieces within it are extremely important. But most of all within nursing, you really have to have that compassion, and you really have to want to help. I know we've had several students come through and make comments that they do it for money, and that becomes upsetting because we're here for patients and we're really here to advocate for them. And then that's it. So thank you. So this is our spine team, social distance with masks on. The front one is one of our neurosurgeons who also goes up into the brain to retrieve clots. So we're very grateful to have our team with us. Everything we do is a team. So if you have any questions,
yeah, please do type your questions into the chat. So Melissa, can you give me some pros and cons of your position?
I love my position. The biggest pro is the patients, the survivorship, and additionally the staff that take on the camaraderie between it, because neuro is so unique. Unfortunately, the con is I work a lot. I average 60 hours a week. I do work from home. I work wherever I'm at. If I take a day of vacation, I'm still working. So there is that.
And Allison, do we have any other questions in the chat?
I'm not, oh, here we go. Is Aurora allowing students to come in and shadow?
Unfortunately, the answer to that is it changes daily.
Yes.
Depending on, unfortunately with COVID, it depends on the census and where we are at and what level. So that's a great HR question. It just depends.
All right.
Okay.
Just going to pause for a second and see if anything else popped up, but thank you so much, Melissa. We'll move on to our last speaker this morning, and that is Sandra Hanman, who is a radiologist. She's going to be talking to us about MRI. So we will see you for a little bit before I share your screen, Sandra.
Hi, like she said, my name is Sandra Hunneman. I have been working for Bellin Hospital for about 15 years in MRI. Prior to that, I worked for about 10 years at NEW MRI. So I've been in this field for 25 years, so I absolutely love it. I wish I had an exciting story as to how I got into my field. I was going to say, if you want to go to the first slide. And then actually, if you want to skip ahead to an average day, it's in 4 slides. When I started schooling, I was 18 and I had absolutely no clue what I wanted to do. So I dug deep and thought, what do I love? Which is, I guess, what I would say to you guys is, don't do what someone else thinks you should do what you have a passion for. So I knew that my passion was patient care. I wanted to do something in patient care, and I really liked science class. So I thought maybe I should do something in the medical field. So I opened up the phone book and I started going through, and I found the Bellin School of Radiology. So that intrigued me. I did a tour, so I highly recommend doing tours for sure of schools that you're looking into. So I did a tour of the school. At that time, they only accepted 6 students. And they weren't going to be starting until the following summer. So I had a semester. So I thought it would be advantageous for me to go to UWGB or TC, take some type of schooling or class that might help me in that field that I was going into. So I went to UWGB just for 1 semester, and I did a biology class, and I also did a Taekwondo class just for fun, because you gotta, when you're doing in the medical field, you have to have a good balance for yourself. So I did those. And then I started my schooling in 1994. So I was 2 years into that. The great thing about the radiology field is you don't have to have a bachelor's degree. There's programs within Green Bay that offer a 4-year bachelor's degree in radiology, or you can do the technical school where they offer 2 years and you have an associate's degree. Pretty much in the state of Wisconsin anyway, it's more about a licensure and not a degree for what we do. So if you choose to do the 2-year route, which a lot of people do, and then they start to work in a hospital or a clinic, many of those clinics will then give you money to go back to school to get your bachelor's degree. So that's sort of a nice perk with doing that. And then some kids, they're in that school mode and they just want to keep going until they get their 4-year bachelor's degree. So that's another option that you have. So mine led me, I did my 2-year schooling, and at that time, and even presently, you don't have to go to school for MRI, what I do. Most of what we do is on-the-job training. All schools, usually technical schools and the 4-year bachelor's school, do offer MRI sections where you can rotate through for like 2 weeks, 3 weeks at different hospitals to get a taste of what it's like, to get a good feel of what we do, so you can see what we do on an average day as opposed to just reading something in a book. So typically my average day is what we have to do prior to the patient even coming to see us is we screen all of our patients in MRI. And that's because we deal with a very, very strong magnet. We have a 1.5 Tesla and a 3 Tesla magnet. We have 5 magnets actually at Bellin. But HSHS has magnets, St. Vincent's, Prevea, St. Mary's, Aurora. Everyone has different magnet strengths, and that's what we deal with. So we have to be very careful when putting a patient into our environment that the patient is safe, that they don't have a pacemaker, and if it is, it has to be MRI safe. Many people don't understand when they have stents, wires, clips, bullets, things like that, though some of those metals are metals that's attracted to the magnet, so we can't have them in there if it's unsafe. So we have to screen them before. You can go ahead to the next slide, Lynn.
Okay.
So patient safety is huge for us. Once we screen the patient for a second time, we bring the patient back with us. The most we typically spend with a patient is 1 to 2 hours at the most. We tend to scan just on one scanner. We can scan up to 10 to 15 patients a day. So you're not with a patient for a long length of time, but patient care is extremely important. In our job, we have many people that are claustrophobic. So to get them through a test, for people that like to be in small spaces and don't like loud noises, MRIs are a struggle. So you really have to take your time and you really have to have good patient care. It's one of our most important things. So we get done with a scan and we can scan pretty much any body part. We get finished and we have one-on-ones with radiologists. They look over our pictures that we're doing, our scans. They let us know if we need to do more pictures so that they can evaluate what's going on with that patient. They do a report and then that report gets sent back to their primary doctor and then they leave for the day. So that's our the length of time our interaction is with a patient. You can go to the next one. So this is what a scanner looks like. You can see maybe why people are claustrophobic. One of the most important things with MRI is that you don't move. And our typical scan, there's not usually one that's shorter than 30 minutes. But taking pictures with an MRI is based off of the water in your body. So if you can imagine moving a glass of water just a little bit, how it causes ripples in the glass, MRI will do the same thing. So it's very important, but very difficult for some people to lay there for that length of time and hold still that whole time. So that's a 1.5. A 3 Tesla won't really look much different. You can go ahead to the next picture. Same look, just a different magnet strength. We have antennas, very much like you guys probably don't remember rabbit ears. In my day, we had rabbit ears on our TV to get good signal. These are coils that we use when we're scanning different body parts. It's kind of like having an HDMI cord hooked up to your Xbox or a game like that. You're going to get much better pictures if you can use things like what you see on the screen. These are basically our antennas, so we can see what we're looking at. So you can go ahead to the next one. So these are, and you can do the next one too. I'll just show you a few pictures of what it looks like when we scan. I don't know if you guys can take a quick guess in your head because I don't think I can hear you, but this is probably our most common scan that we do. This is a head scan, and we do them in different planes, side to side, front to back, top to bottom, all the way through the head, just very thin pictures. So you can go ahead. Same thing. You can do the next one too. This is a vessel study, so we can actually make your brain disappear and just show your blood flow. So the one on the facing my left would be of the head, and the longer looking one, that's what we call your carotid, your neck vessels. You can go ahead. Now this I would relate with Melissa. Melissa does the neurological. She sees the neurological effects that patients have, facial droop, things like that. I'm on the other end. She sends patients to us and we scan their brain. And unfortunately, that white area, that's what you would call a stroke. So they send patients for a CAT scan or an MRI. And this is unfortunately a stroke on MRI. You can go ahead. I'm going to keep Lynn clicking fast. This is, if anybody wants to do a quick guess in their head, this is a neck scan. So we look at the fluid coming down is bright white. The cord is the dark part right behind those vertebral bodies. So we look to make sure that there's not a disc popping out. A lot of times people can have parents that or friends, family members that have numbness to their arms. A lot of times that's coming from their neck. You can go to the next one again. And go ahead, one more. And this would be your back. So when people are getting symptoms in their lower legs, a lot of times they'll have their low back scanned, and that's what that looks like. So you can go ahead. And that's called the lumbar spine. And that's a side to side and front to back. If anybody has a quick guess, that's okay, you can go ahead. This is what your knee looks like. We see a lot of, we have out at Titletown Clinic, we scan a lot of orthopedic injuries. That's primarily what we do out there. So a lot of athletes. You can go ahead. This would be hips or a pelvis, to give you a good look at that, front to back, and then a top to bottom picture slicing through the body that way. You can go ahead. This would be, if anybody has a quick guess in your head, but that's your shoulder, different angles through your shoulder, you can go ahead. Anybody have a quick guess? That's your wrist. So again, front, back, we always have 3 planes, front to back, side to side, and top to bottom. You can go ahead. And this would be your ankle. And you can keep going. This one would be your abdomen. So we can see liver and kidneys. We're pretty much looking for any pathology. Most things that come through to us, they usually have come in with a symptom. The doctor will tell us what he's looking for, and then it's our job to help figure out what's going on. So you can go ahead. That would be a breast. We do, they have breast mammos and MRIs that they do. And I will add with this, that's the other nice thing about getting into the field of radiology is you can get into that field and maybe feel like you want to expand further. It is imaging has many modalities that you can go to from there. So maybe you're doing imaging, but then you realize I want to go into CAT scan, or I want to go on to ultrasound, or I want to go into mammos. That would be, this would be a good field if you have a direction, but you're not exactly sure what you want to do, and you have opportunities to advance in many different areas. So you can go ahead. You could probably keep going through the images. And so this is why I do MRI. Every single day is different. I love it. I love the patient care. It is called the gold standard for imaging. So we are constantly changing, constantly advancing. Things are becoming new all the time. So it's never just like pretty much any of the Jessica or Melissa that spoke today. Every day is a different day, and every day is exciting. You should just always be loving what you do. You can go ahead. There's one last screen. I just wanted to see.
Oh,
Maybe it could be gone. That's all right.
My last one.
That's okay. It was just what a baby looks like in the stomach. So it looks pretty neat. They usually can't guess that one as quick.
Do we have some questions, Allison?
We do. A question would be, do different states have different requirements for MRI?
They do. It's starting out, I can't speak individually for MRI, but I will say that different states have different licensures for radiology. So when you graduate from a program, you will take an exam, a test. So when I graduated from my 2-year school, I took a test in radiology, and then you're considered a radiologic technologist that's registered. I then went on and took another test in order to be able to do mammography, so breast imaging. So that's another test that you do. MRI, same thing. No specific schooling for it. Each school talks about it, but then you have to be registered in that. So other states have different licensures, I'm sure, that you have to follow. So I hope that answered that.
Great. Here we go. We have a couple more. What's the most difficult part of the body to image?
Abdomens are pretty hard. We've gotten much better over time. Hearts, we have some technologists that do cardiac scans. As I mentioned earlier, the most important part with MRI is that you hold still. So when you have the natural movement of the heart that we keep going and the natural movement of the stomach, there's things that we have to do as technologists to work around that so that we get good images without the motion. So things like that are usually a little more difficult. Anywhere where the body has natural body movements makes it a little more difficult.
That makes sense. Another question, does the salary change whether you graduate with an associate degree versus a bachelor degree?
That's a great question. Actually, I know I can say with Bellin, I can't speak for other facilities, but I think it's pretty much across the board is you start where you start. It does not matter what your degree is, because it's more of a licensure at this time. That could change over time, but right now when you're hired at least with a hospital. You're hired at a base pay of what an MRI tech gets, or what a CT tech gets, or an imaging tech. Every modality pays differently. but they all start at the same base rate. I'm sure if you have experience, then you would fall into a different level, but you are your own pay scale category in each modality.
Great. I have the same question that Madison typed in. What does happen with a patient that has a pacemaker that isn't MRI safe?
You cannot have an MRI. We can't scan you. Most of the pacemakers that they're making nowadays, there's companies called Boston Scientific and Medtronic. What they do is they have an affiliate from their company come into our center, and they actually put the pacemaker in an MRI pacing mode. So we can scan them under specific regulations, but they stay there and they monitor the pacemaker while we scan them.
Sure. I think though, her question may have been like literally what would happen?
Oh, it literally, if they went into the
Yes.
scanner, their pacemaker would likely stop working. Anytime you have like a phone, anything electronic, pumps, people have diabetic pumps, things like that. Those, if you bring those into the scan room, not even into the scanner, but into the scan room, it'll stop working.
Okay. And Lynn, I think we have maybe a question for all three, if that's
Yeah, I was
possible,
just
but
gonna say, we've
would
got
there,
about 5 minutes at the end. So the one question that came
Okay,
through
yes.
when we registered from one of our students was, what opportunities are there for individuals with disabilities in any of your areas of healthcare? So any of our speakers can chime in on that.
I actually have an interesting story with that. We had a patient who was admitted after rollover, and her story is that we actually recorded it because it was inspirational. She had a rollover. She lost the ability to walk temporarily. And through rehab, she actually came back enough that she came to work with us as a sitter. So one-on-one with patients who just needed somebody to sit with them. So she isn't able to use her hands as well. They don't have the fine motor that you would need with some of the nursing techniques, but she's able to sit with patients and do some of that care.
Cool. Any other ideas from our other two speakers?
I can speak from in our field, you do have to have certain requirements that are met, weightlifting requirements, things like that, that they do ask that you meet only so that you don't injure yourself possibly more on the job. Bellin as a whole, where I work, I know that they do offer multiple jobs that offer that offer you an occupation that are specific to your needs. There's a gentleman that I've worked with at Bellin for, he's been here more than 25 years and he's completely hearing impaired. And he works in shipping and transferring. So they do definitely go out of their way to, which I believe most hospitals would do, to try to find something that would meet your specific need or challenge.
Awesome. All right. Well, we are coming up to the top of the hour. So again, next week, we will have that deep dive with Chief Nursing Officer Ken Nelson from the HSHS Hospital Consortium. And then we will be in our regular healthcare virtual job spotlights hearing from an ER doctor, dental hygienist, and the Prevea VP of Clinical Operations. So if you know other folks that may be interested in any of those areas, please give them the registration link. And I did send out a survey link to everyone who registered ahead of time. We love to hear from you and get suggestions for other job spotlights that we might do the rest of the year. So please go to the survey and give us some information. And thank you to our speakers today. We really appreciate your time. Fascinating information. So I hope that our students learned a lot that they did not know before and have some better ideas of what all the opportunities are in the healthcare field. So thank you all so much and have a great day.
Thank you, you too.